Good evening, student. Hope all of you are fine. This is the welcome to ophthalmology classes. Today is the continuation of the OSPE class, and this is the syllabus. Photograph, most of the photograph discussion completed. Instrument, some instrument today we will discuss. Lenses. Lenses means convex lens, concave lens, and there are some cylinder drops also discussed. Examination and procedure. A very procedure sequence test discussed. Even we discussed in my lecture class sequence test and SICS, procedure of SICS, and procedure of visual acuity, procedure of eye pad bandage. This four procedure is very important. Repeat: number one, sequence test; number two, SICS, procedure of SICS, cataract surgery; and third is visual acuity testing, and number four is eye pad bandage. And specimen, actually two specimen will choose. One is cataractus lens, that is nucleus. During cataract surgery we extract the nucleus. This is just one specimen, and another specimen is enucleated eyeball. Usually, in case of retinoblastoma case, we enucleated the eyeball, and cadaveric eye, we enucleated the eyeball. And these two specimens, there is scenario like question. It is usually chapter from like uveitis, like glaucoma, like pathological myopia. Usually, we'll choose scenario like even corneal ulcer, allergic conjunctivitis, especially vernal keratoconus, we will choose. X-ray CT scan. There is another station, and counseling already discussed and history discussed. Now, today, rest of OSPE, now I try to discuss, and this is the last class. You try to listen, attention, your listen should be proper. Just a minute, you wait for a few seconds for starting. This drop is very important. Again, we'll repeat. There is a questions like identification. When question is identification, there's just, although there is a root here, of course, properly write atropine sulfate, and question may be when it is used, especially this is the drop, so your use should be as like I. Like at first you write corneal ulcer, uveitis, then if anybody like another thing, malignant glaucoma, neovascular glaucoma, and toxic effect, systemic toxic effect, you should read, and there is some pharmacology action of atropine on eye. You should prepare, and this is the ocular viscous surgical device. This is a syringe, and this is a cannula. In syringe, there is a gel. This is a viscoelastic substance. So, what are the substance or materials formation of ocular viscosurgical device? Usually, common is hydroxypropyl methyl cellulose. It is also important in viva process. Some examiner choice asks to you what are the different types of material for ocular viscosurgical device. Then you another are sodium hyaluronate, condotin sulfate, methyl cellulose. But popularly hydroxypropyl methyl cellulose, this substance usually during cataract surgery and others intraocular surgery we used. So this is a instrument viscoelastic substance or ocular viscosurgical device, very important. And what are the aims or rule of this? First, it creates space usually in anterior chamber. It makes a space in anterior chamber and protects endothelium during surgery. Endothelium of which structure? Cornea, and lubricates the IOL during implantation of IOL in cataract surgery. So aims is, there is a aims or use or role, whatever you say, creates the space, protects and lubricates. And what are the indications of this ocular surgical device? Usually, first, you we remember when there is any type of question or even in Viva Pussy, your answer should be chronological. Chronological means according to importance, we arranged. Cataract indication is cataract surgery, penetrating keratoplasty, glaucoma filtration surgery. There is glaucoma surgery during trabeculectomy and vitreoretinal surgery. So among them, which is very important, cataract surgery. Second most important is penetrating keratoplasty and glaucoma surgery. Complication. Usually, in aqueous humor is the materials of aqueous humor, but there is abnormal. If during cataract surgery we will not remove properly this viscous substance, so this viscous substance may retain in aqueous humor, so block the angle of anterior chamber by ocular viscosurgical device, resulting secondary rays of IOP. So complication is secondary rays of IOP. Why secondary rays of IOP? Because there is a impairment or hamper the drainage of aqueous humor. Another important drug is pilocarpine drug. This is the anti-glaucoma drug. So when you read pilocarpine, you should properly anti-glaucoma drug. Others drugs of glaucoma you should read properly. Pilocarpine. This is the parasympathomimetic. This is the some examiner choice even in Viper Pussy, even OSPE. What are the pharmacological drug of this pilocarpine is cholinergic drug. Cholinergic drug. Usually it causes meiosis, and preparation available in our country 1%, 2%, 4%, but 2% is very important in diagnostic and therapeutic use we prescribe to patients. And what are the uses of this pilocarpine? There may be diagnostic use, there may be therapeutic use. The diagnostic use, uh, uh, it is not important to you, but if examiner, even in Viper Pussy, asks to you, have any diagnostic use? For diagnostic use, you say to detect peripheral anterior synechiae and Holmes ADP-fully. ADP-fully. For diagnosis of ADP-fully, we prescribe to patient or confirmed by 0.1.25. So this diagnosis test, it is actually important for Viper Pussy. And therapeutic, this is very important. Usually, this is the anti-glaucoma drug used in primary open-angle glaucoma, and usually primary open-angle, sometimes you use in primary angle closure. Both. So your answer is therapeutic is glaucoma, primary open-angle glaucoma, and primary angle closure glaucoma. Pharmacological effects of eye in glaucoma. It is this mechanism of action. It is important in OSPE as well as in vibrosities. But try to understand. It is used in previous slide. We said to you, this is the primary open angle glaucoma and primary angle closure glaucoma. It is used in chronic open angle glaucoma. It is used in chronic open angle glaucoma, that is primary open angle glaucoma, to increase the facility of aqueous outflow due to ciliary muscle contraction and pull on scleral spur and trabecular meshwork. This is the open angle glaucoma, just helps to enhance the outflow aqueous humor. And it is used in acute angle closure glaucoma to move iris away from the angle. Iris, in an acute angle closure glaucoma, there is angle is closed. If when I give pilocarpine, it helps to away the iris from angle, and resulting angle is open and enhance the outflow. So this is the chronic why used in chronic open angle glaucoma and why used in acute angle glaucoma. This is a different separate mechanism action. Try to remember. And side effects. There may be ocular side effect, there may be systemic. Ocular is very important. It causes some contact allergy, follicle, very important, even in viral positive. What are the causes of follicle? Viral and chlamydia, and also important pilocarpine drop. It is very important, very important in fiber positive. Examiner wait if any student pilocarpine say or not say. So contact allergy, follicle. This is a virus. This is the allergic contact. Allergic conjunctivitis, contact allergy, ocular, and myopia. It causes some myopic shift and meiosis, constriction of pupil, and shell of endothelium. This is the ocular side effect. And systemic, there may be sweating, there may be salivation, there may be headache, there may be brow ache, there may be bradycardia, there may be hyporesia. Usually, when pilocarpine absorbed systemically, then systemic ocular adverse effect occurs. Usually, this systemic adverse effect is rare. This ocular side effect is common. And there is some instrument you should clearly know. This instrument is universal eye speculum. In OSPE station, there is a one photograph of universal eye speculum. Question may be, what is your identification? Answer is universal eye speculum. And what are the uses of this instrument? What is the purpose of this instrument? That answer, there is some answer here. It is a spring identification point. It is a spring, and there is a two limb. This is the spring with screw. Spring with screw. Spring with screw. There is a two limb, and it is called universal. There is a particular name of this universal. Universal means for all. It all means that's the right eye and left eye. It is called universal because it can be used for either right eye or left eye. That means both eyes, both eye. No need of right eye, no need of another instrument, not in left eye, no need of another instrument. One instrument, maybe when you need in right eye surgery, then you use this instrument. When need in the left eye, then this instrument used in both eye. And purpose, this is purpose, just it helps to open the eye. It is used to separate the both eyelids for good exposure to eyeball. Suppose there is any corneal foreign body you need to remove. So expose the eyeball, then remove. And uses. This is the really important removal of foreign body of cornea and conjunctiva. During pterygium operation, this instrument is used. During squint operation, instrument is used, and during evisceration and enucleation. So this is the uses of universal eye speculum. Very important. It is this instrument is commonly examiner choice for auscultation. An indication of this is regarding related to OSPE question. What are the indication of enucleation? As you know, it is maybe discussed in our lecture class. Absolute indication, retinoblastoma and malignant glaucoma. Malignant melanoma. And this is the tumor. Malignant melanoma is the choroidal tumor or malignant melanoma relative painful blind eye due to trauma. Enterostaphyloma, thysis valve, absolute glaucoma. Absolute glaucoma is usually painful and no perception of light. Patient is feels so much pain in affected eye. So need to enucleation. To collect donor eye from cadaveric body for keratoplasty. When we will do keratoplasty, we need a cornea. How will you collect from cadaveric body? And process is here enucleation. This is the absolute indication. There is the relative indications. And this is another instrument known as irrigation aspiration two-way cannula. Two-way cannula, there is a two opening, one for irrigation and one for aspiration. Irrigation means irrigation by which saline, maybe by normal saline, maybe usually normal saline not used in eye surgery. Best solution is the balanced salt solution. Ringer salt solution, but this is a very costly. In our department or available instrument available solution is Hartmann solution. Usually Hartmann solution as per composition as per it is the same to aqueous immersion, so it is not harmful to eye. So irrigation by which saline, which number one Hartmann solution, then Ringer lactate, then balanced salt solution. Better is balanced salt solution. And aspiration, aspirated either in aqueous, in anterior chamber there is a aqueous humor. When you will during cataract surgery, we will give some viscous substance. A few minutes ago I say some viscoelastic subject if retained in aqueous humor there is a chance to secondary glaucoma. So this viscoelastic substance for aspiration of viscoelastic substance, this instrument helps for aspiration. So there is in this instrument opening two, one for irrigation and another for aspiration. Regarding this, regarding instrument related some question irrigation with valence salt solution and Ringer solution, Hartmann solution. We practice by Hartmann solution. Aspiration, what are the materials may be aspirated during this instrument? Cortical matter of lens. When during cataract surgery, there is some cortical matter retains. So aspiration of cortical matter need this instrument, viscoelastic substance, and blood clot. Blood clot. There is a hyphema. Hyphema means accumulation of blood into the chamber. If if hyphema persists even 5 days, 7 days, not absorbed automatically, on that situation, need to aspirate it of blood clot. Aims irrigation of anterior chamber and aspiration of cortical matter of lens, OBD desmin viscoelastic substance, and clotted blood from anterior chamber. This is the aim. Washing the anterior chamber, and for forming the anterior chamber. This is the purpose or aims of this instrument. Irrigation, aspiration, washing the anterior chamber, and for forming the anterior chamber. And what are the uses of this instrument? That means intraocular surgery, cataract surgery, glaucoma surgery, keratoplasty, and repair of corneal injury. And complication of this very very important. This instrument every examiner so much like about complication of this instrument because these instruments when you work in anterior chamber there is a chance to touch on the corneal endothelium and and there may be touched on the posterior capsule. When we will work with this irrigation or especially during surgery, there may be important two complications usually may occur. One is corneal endothelial defect, another is posterior capsule rupture. Corneal endothelial damage and posterior capsule rupture. Very important. Every examiner choice about this like of question. There is another instrument, the Cetilis pans forceps. Just this is a DCR pans forceps. During DCR operation, we will use just to cut the bones and enlarge the ostium during DCR operation. Complication, there may be damage to nasal mucosa and lacrimal sac and damage to surrounding tissue causing bleeding. So what are the purpose of this instrument? Just cut the bone and enlarge the ostium. There is another important instrument, Calagion clamp, and Calagion clamp name say what is the function of what operation it is used. Usually it is used in Calagion surgery. So what are the function of purpose of this instrument? Purpose and uses there is a difference. Function, fixation of Calagion eyelid, fixation and eversion of the eyelid and hemostasis. There is two functions of this Calagion clamp. And what type of operation done by the instrument? Calagion operation. There is a particular name of Calagion operation is incision and curettage. Everybody mistake during OSPE examination, even in written examination, incision and curettage. And spelling is very important. Some examiner during watching the khata, they observe spelling is correct or incorrect. So Calagion operation, incision and curettage. And there is a knife. Instrument is crescent knife. Crescent knife. It is used in cataract surgery, even trabeculectomy, even glaucoma surgery. So identification point is a blunt tipped level level up knife having cut splitting action at the tip and both sides. There is a blunt, there is a sharp function, and this is a bevel. And function of this crescent knife, usually it helps to make a tunnel in sclera or cornea during glaucoma surgery and cataract surgery. So what are the function of this instrument? Function is make a tunnel shaped incision in the sclera and cornea. And this is the uses is SICS and trabeculectomy. Another instrument is lacrimal cannula. Lacrimal cannula, you know, it is used in secpedency test. Secpedency test. And needle shaped punctum dilator is another instrument used in secpedency test, usually for dilatation of punctum. For dilatation of punctum, and it is also this instrument used when you discuss about uses. There is a proving another option, especially in congenital dacryocystitis. This instrument helps for proving. And this instrument is DCR tube. DCR tube is a silicone made. Usually, usually we'll use when DCR operation is failed. So when re-DCR need, then we will use DCR tube. But some examiner choice or wants so many uses of this DCR. Usually, main use is re-DCR, but some examiner wants another use. So what are the uses? In case of failed DCR during re-DCR, if tear the lacrimal sac, this is a secondary use. But when some examiner choose primary use, during DCR operation, you tear the lacrimal sac and tear the nasal mucosa. That primary setting, you may use the DCR operation. So this is the secondary use. That means when failed the DCR, and during first time when there is a tear the lacrimal sac, tear the nasal mucosa, unable to anastomosis properly during DCR operation, then you must give DCR tube. Otherwise, patient develop failed DCR. And if excessive hemorrhage during DCR operation, you may advise for DCR tube. So, what are the important uses of DCR tube? First, VDCR. Then, if during operation there is a tears of the lacrimal sac and tear of the nasal mucosa, then we'll choose to use DCR, and during DCR if there is excessive hemorrhage. And for the sterilization technique, there is a gamma radiation. This is a OSPE question. For the sterilization technique, gamma radiation. And this is a CO tonometer. You know, for measuring the intraocular pressure, important instruments are CO tonometer, Goldman appellation tonometer, ER pop tonometer, and tonometer. So many instruments, but this is the popular instrument. It is available in IOPD in our department. Identify. This is a picture showing in auspication. What is identification? Just use right CS tonometer with with some weight like 5.5 gram, 7.5 gram, and 10 gram. If present, this is the weight. This is the weight one, 2, 3. If present, you must write with 5.5 gram measuring weight, 7.5 and 10 gram. And write down its uses. Uses just you measure the intraocular pressure. Some examiner may ask to you, or even in OSPE, what are the normal pressure of eye? Your normal pressure of intraocular pressure 10 to 21 of 21 millimeter mercury. Hope everybody know about this. What are the other instruments to measure the intraocular pressure? Whole main appellation tonometer, ear cuff tonometer, tonopen. This is the OSPE question. This is the ophthalmoscope. Identify the instrument. This is a picture showing retinoscope. This is the retinoscope. This is the retinoscope and this is ophthalmoscope. Just differ ophthalmoscope. How will you differ from retinoscope? Retinoscope usually instrument is long and ophthalmoscope comparatively short. So this is a long instrument of usually sometimes difficult to differentiate retinoscope from ophthalmoscope in photograph. So there is a key point. Retinoscope is long instrument comparatively, and ophthalmoscope is a short instrument. And write the uses of this retinoscope. It helps to diagnosis and correct the refractive error. What are the other methods of diagnosis of refractive error? And this is discussed in my lecture class. You collect from my lecture class. And this is ophthalmoscope. What are the purpose of this instrument? To see the retina. To see the retina. But unfortunately, when examiner asks to some student what are the purpose of retinoscope, some students mistakenly say, sir, function of retinoscope is to see the retina. Retina is attached, so mistake. Function of retinoscope is to diagnosis and correct the refractive. What are the functions of ophthalmoscope? To see the fundus, to see the retina. Okay, I think clearly you understand what is retinoscope and what is ophthalmoscope. Ophthalmoscope to see the fundus, retinoscope to correct and diagnose the refractive error. And this is the trypan blue. Spelling is very important. Some examiner choice about spelling of trypan blue. Trypan Blue means Neil. Trypan. This is a scientist name. So identification is trypan blue. There is a some vial contain bluish solution. And what are the others dye used in ophthalmic procedure, different disease diagnosis, like fluorescent dye, you know already. And there is another important dye are indocyanin green and LCM blue. Write down the uses of treatment blue. Usually, it is used in cataract surgery for staining and contrasting the anterior capsule. Repeat my answer. What are the uses of treatment blue? Usually used in cataract surgery for staining and contrasting the anterior capsule of lens. You know, in cataract surgery, during cataract surgery, need to capsule is removed, anterior capsule is removed. If you not clearly identify the anterior capsule, it is tough to remove. So what are the purpose of treatment blue? Staining and contrasting the anterior capsule during cataract surgery. This is the squint tube. Usually squint name say what are the uses, mainly used for squint surgery, and another use is during cataract surgery. It acts as a lens expert. It helps to deliver the extractor lens, also helps in during cataract surgery. And another use, differentiate the pseudoteresium from pterygium. Pseudoteresium from pterygium. Usually, in case of pseudoteresium, this going to pass or not pass, pterygium pass or not pass. And cat's paw. It is another instrument used in DCR operation and dacrocystectomy operation. It helps to retract the skin. And corneal seizure. Seizure identification is corneal seizure or sclerocorneal seizure used to enlarge the corneal or corneoscleral incision during extracapsular cataract extraction or to enlarge the corneal incision in keratoplasty. Main things, it helps to enlarge the incision during cataract surgery or even in keratoplasty surgery. And lens is a convex spherical lens. It is not only important in OSPE. Usually there may be during viva examiner comparatively examiner wear some spectacle. Some examiner very much choice remove his or her spectacle and give your give to you, and you say it is spectacle. What are the lens fitted his spectacle, either convex or concave or spherical or cylindrical. So you must know how will you identify the lenses. So this is the identification point. Number one, in case of convex lens, magnification of image of object. Magnification of image. Image magnification. Magnification means large. An image of object moves it both meridian in opposite direction. If you moves in both meridian in opposite direction, and there is a no distortion of image. So there is a three important point in case of convex bearing. One is magnification, and another second point is object moves in both meridian in opposite direction, and there is a no distortion of image. And what are the uses of convex spherical lens? It is also important in written examination. Some examiner choice. What are the uses of convex lens? Hypermetropia, presbyopia, and aphakia. In case of aphakia, need plus 10 diopter for distance and plus 13 for near. So this is the convex lens. These are pictures of convex spherical and convex cylindrical. This is the convex spherical and convex cylindrical. There is some clue helps to you from photograph. How will you identification of convex lens? Because in Viva there is some identification point, magnification, image moves, and distortion. But in OSPE there is impossible to clearly identify by convex or cylindrical. There is a mark. If plus, there is a clue. If plus, that means convex. If plus, that means convex. If exist point, this is the cylindrical point, the exist point. Is exist point, note this is the cylindrical lens. So there is a both of convex lens, but if absence of exist mark, that means spherical lens. If exist mark present, that means cylindrical lens. And convex spherical lens, this identification point is magnification of image of object. Magnification in convex lens we discuss magnification. Here magnification, an image of object moves in both meridian in same direction, and there is a no distortion on it. This is the convex concave spherical, and uses is myopia, and there may be questions like refractive error, especially myopia. And another, these are pictures of concave lens. Here concave spherical, there is a no exist mark. There is a no exist mark, just minus, that means concave spherical lens. Minus mark indicate there is a concave. The convex spherical lens identification is magnification. Image of objects move in one meridian. In case of convex spherical, moves in both meridian, but in one meridian in one opposite direction, and distortion of image. In case of convex spherical, no distortion. Here distortion. Use is hypermetropic astigmatism. Concave cylindrical, magnification object is the same like convex spherical. Image of objects move is one meridian in same direction, but here there is some difference. In case of spherical, moves in both meridian. Here cylindrical lens in one meridian, and distortion image, but in case of spherical there is no distortion image. Use is myopic astigmatism. There is some question. Suppose this is scenario like, or maybe important question in OSPE. A patient who is about to undergo cataract surgery has the following result during her pre-assessment. Before cataract surgery, there is some investigation need, especially biometry. Here, discuss about biometry. Here, axial length is 23 millimeter, and keratometer reading 42 and keratometer reading is 44. This is when you give to calculate, you take average of keratometer. So constant is 118. Here, this is the SRK formula. So question is, there is some data here like A, like axial length, like keratometer reading, and you calculate the lens implanted lens power. So again, repeat the question. P assessment some data like axial length, keratometer reading, and constant 118. So calculate the lens power for M2P. This is the calculate power. Formula is P equal to M minus 2.5 L minus 0.9 K. 0.9 K. So A already I mentioned constant 1180 and 2.5 axial length about 223 and 0.9 and 40th is the average and 21.8 that means 22. That is a some examiner choice. There is a by SRK formula you calculate the power. And there is a very another procedure of eye pad bandage. There is a photograph how you give eye bandage. Usually eye bandage so many use I we will use eye bandage, especially here discuss about there is a corneal laceration. Corneal laceration they need to eye pad bandage. Indication of eye bandage. Following trauma. Any types of following trauma like corneal abrasion or corneal laceration to arrest of bleeding, to reduce swelling after eyelid surgery, following eye surgery, even after eye surgery, cataract surgery, need to eye pad bandage, and for a child to ensure the pad is not disturbed. That means in amblyopia you use the eye pad bandage, especially in sound eye or amblyopic eye, we give eye bandage. Usually in sound eye, we give eye bandage. And hypemia and vitreous hemorrhage. On that situation, on that purpose, we'll use eye bandage. And procedure of eye bandage. Before, before giving to eye bandage, you must wash your hands. Must wash your hands and instill some surface anesthetic agent. You know there are important surface anesthetic agents are oxybuprofen is available in IOPD or any pharmacy and apply eye ointment, especially antibiotic eye ointment, and eyelid close and apply an eye bandage gently. There is a OSPE station. There is a pictures here. Question is, what are the identification? Here, eye appendage is given. This is the answer. And what are the second question? What are the common uses of eye appendage? This is the answer. And procedure of eye appendage. This is the answer. So, very important to you. Thank you. And this is the last class of OSPE. I hope everybody may be benefited. And there is a 3 OSPE class already discussed. Try to review and yourself, and if I take time in future again, if I will discuss OSPE. Thank you.